Okay, so this lecture we're going to cover some general guidelines on how to reduce risks and maximize benefits. I thought we'd start off by talking about what we know about risks in medical patients. And you may be wondering, why medical patients? Well, the thing is that most of the research on the risks of cannabis has been done with recreational users. And of course, a lot of people want to know what are the risks in terms of medical users. So for many medical users, the effect of getting high from cannabis actually, for a lot of them, that's a side effect. And a great example is cancer patients. I had a cancer patient come by my office a couple of years ago, and she was talking about basically, when she's using cannabis, the problem that she has is that she's compromised cognitively. It makes it hard to get things done. Sometimes, obviously she can't drive. So being high can be a side effect for a lot of these patients. Now, thankfully, even though we don't have research in the United States on side effects or risks or harm in medical patients, again, most of the research in the U.S. over the last 50 years has been done in recreational users. We do have a body of research that we can look to that comes from Canada and Europe. And the reason we have that research is that there's a plant-derived medication called Sativex, which I've mentioned before, which is produced by GW Pharma. That's a plant-derived formulation, 1-to-1 THC to CBD. And that was approved in Canada in 2005, and it's been approved in Europe, or many parts of Europe now, for quite some time. And so in order to get approved by their versions of the FDA, GW Pharma had to supply clinical trial data. And so there's a fair amount of data on the potential side effects and risks of a 1-to-1 preparation in medical patients that comes out of Canada and Europe. So just to sort of cut to the chase here, while there are a number of phase 3 clinical trials, there are also some sort of phase 4 post-marketing registries. And here's a citation of a couple of them, citations for 2 of them. And these are really useful for looking at what happens once a medication is available to patients over a long period of time. In this study, they summarized data on 941 patients where the patients had been using cannabis, this particular preparation of Sativex, for 954 days on average. And the mean dose was 14.6 milligrams of THC and 13.5 milligrams of CBD. So you can see this is a really good data set in terms of it's got a large sample size. These people on average have been using for a long period of time, and sort of a moderate dose. And so the most common side effects that emerged in this work were actually side effects that emerged at the very beginning of use. And typically it was dizziness and fatigue, and those side effects dissipate over time. Also, the papers report no evidence of abuse liability or diversion, and no evidence of short or long-term cognitive effects. These pictures on the right, I just find it somewhat interesting that here, this is a picture of Sativex, the bottle that Sativex comes in. It's an extract. And so, it's about 100 years that separates Eli Lilly's version, right, from 1909, which was also a liquid extract, from what we have today, which is Sativex. Again, technology has improved quite a bit, so they're different, but in some ways very much the same. So, but separated by 100 years. Okay, so general guidelines to reduce risk and maximize benefits. You would think there would be several papers out there that discuss ways to reduce risk from medical cannabis and ways to maximize benefits. But in fact, no, there are not several papers. There's just one paper. And that one paper by McCollum and Russo only came out a year ago. So this is a topic that should have been addressed a long time ago, but just wasn't for various reasons. Well, in any case, it's very important that people are educated about how to minimize adverse events. And the strong advice in this paper, and also, of course, advice you'll see in terms of public health messages, the advice is start low, go slow, and stay low. And the recommendations here for inhalation as a route of administration is 1 inhalation every 15 minutes until the patient reaches the desired effect, or until the patient starts to feel effects that they don't like, right? So if negative effects start to emerge, then you need to stop. And of course, if you reach the desired effect, whether it's pain relief or muscle spasticity relief or whatever the case might be, then it's reasonable to stop too. That was for inhalation. So what about oral or edible administration as opposed to inhalation? And so it's worth noting that a lot of people prefer the oral or edible route, especially for more chronic conditions, because the effects last longer. And also because a lot of people don't want to inhale anything into their lungs. And so the disadvantage, however, of the oral or edible route of administration is that it takes longer for the effects to start. So the advice here in terms of reducing the potential for adverse events is to start with a product that has 2.5 milligrams of THC or less, right? So it's a small dose of THC. That's a good place to start. Wait 2 hours or longer. This is very important. Wait 2 hours or longer before taking any more of that product. The problem is there's a delayed onset, so you may not feel the effects for a couple of hours, and if a person takes more before 2 hours, you may end up taking too much, and that's how people end up in the ER, because they're very uncomfortable, and this is how it works, that they end up taking too much because they didn't have that 2 hour window before taking more. It's also worth noting, and they note in the paper that a patient can supplement an edible with inhalation if they need some fast-acting effects. And so, for example, to address breakthrough pain, for example, you can potentially combine those two to benefit from the fast-acting effect, but also benefit from the longer-acting effect. And then finally, they suggest also that CBD might mitigate the side effects of THC. So basically suggesting that preparations that include both CBD and THC are probably better than those that do not contain CBD. And the truth is, I've never seen anything to suggest that having CBD in a product along with THC does anything negative, right? So it makes sense to look for those products that combine the two. Okay, so some more points from McColeman Russo. Another way to mitigate any negative effects is to actually use it at bedtime. And so that's a suggestion they have. To be more specific about how to increase or titrate up in terms of dose, a person might start at a low dose for the first day or two, and then begin to increase over the next couple of days by 1.25 or 2.5 milligrams of THC at bedtime, and then continue to do that until the desired effect is reached or side effects emerge. So that's the stay low, go slow part. Okay, so then also let's say a patient's in a situation where they need to use during the day. Same kind of thing, starting off with a low dose of THC, and then maybe going to twice a day, the beginning of the day and the end of the day, and then increasing as needed or as tolerated. They also suggest exceeding 20 to 30 milligrams per day may increase adverse events without actually offering any benefits in terms of increasing efficacy. So I think it's worth noting that to be careful about the maximum or the overall dose as well. So what about CBD dosing? And this is a very tricky thing. People want to know more about cannabidiol and what doses of CBD are effective. And this is an area that desperately needs more research because we just don't know what an effective dose of CBD is. And if you look at the research literature, some of the published studies, a lot of them are using doses greater than 500 milligrams, but the doses that are available in, all over the U.S. are typically much lower than 500 milligrams. And it's just not clear what an effective dose is. And so, but when it comes to taking preparations that combine THC and CBD, it's important to note that the limitation in terms of dose comes from the THC side, not the CBD side. So as a quick example, let's say there's a product out there that is 20-to-1 CBD to THC. So basically it might have 100 milligrams of CBD and only 5 milligrams of THC. Well, that 5 milligrams is a moderate dose, right? So this is the limitation. The limitation is the THC, and you need to be careful about the dose of THC. So that's the thing to watch. Whether this is 100 milligrams or 50 milligrams doesn't make a difference, but whether this is 5 or 10 might make a big difference. Okay, so contraindications, pregnancy and lactation, we've talked about that already. Cardiac disease, if you have any history of cardiac disease, very important to talk to your healthcare provider. Lung disease, obviously a contraindication for inhalation, anything that compromises lung function. And then history of psychosis or addiction. Obviously, psychosis has been linked with cannabis. CBD only or pure CBD is the exception here. So over time, most patients develop tolerance to the side effects and the negative effects. So when it comes to things like changes in cognition, motor control, fatigue, dizziness, typically those dissipate over time without losing some of the positive effects. This is just a table from the McCollum and Russo paper noting the side effects, most common side effects, less common and least common side effects. And it's also worth noting they have some interesting information in that paper about how healthcare providers should be discussing potential risks and also how patients should keep an inventory of symptoms in order to understand better how the cannabis product is helping them reduce symptoms. So I think these are worth these resources they talk about in the paper. They're awesome. You should check them out. So in conclusion, many of the harms discussed in the last few lectures as part of this module may be mitigated by using appropriate products and dosing. Using flower through inhalation is faster acting and easier to titrate, but may irritate the lungs and may not be desirable for a lot of people. The oral or edible preparations offer some advantages in terms of being longer acting, so the effects last longer, which is good, but also it takes longer for the effects to kick in, which is can be a bad thing. And then CBD combined with THC definitely has some potential advantages over THC only, and CBD may mitigate some of the undesirable effects of THC, may also add therapeutic effects, and I can't see any evidence to suggest that CBD may have a disadvantage in terms of being combined with THC. So it's important to look then for products that combine CBD and THC with a 1-to-1 ratio or more THC. And then just a few additional thoughts. I just want to reiterate that public health message, start low and go slow. It is so important. It's just very discouraging to talk to patients, maybe a Parkinson's patient who was never given that information, who had a very negative experience the first time they tried a cannabis product. So again, that message is super important. It also highlights the need to educate healthcare providers, dispensary workers, and consumers about how to dose safely to avoid side effects. Also, it's worth pointing out again how important it is to keep these products out of the reach of children and pets. We discussed that in one of the previous lectures. It's also super important to know where these products are coming from, to make sure that you trust the company that's producing them, knowing that there's no contaminants, making sure there's no heavy metals, mold, etc. And then also, of course, trusting that the dose is accurate. These are very important considerations in terms of potential harm. Highlighting again the need to communicate across healthcare providers and patients, and it goes both ways. So patients very much, when I talk to healthcare providers, physicians, they really sort of drive home the point that it's super important for them to know when their patients are using cannabis products so that they can factor that into their thinking. And likewise, of course, it's very important for patients to be able to get information from their healthcare providers about the risks and benefits of cannabis. So this need to communicate is very important. And then also highlighting here how important it is to dose carefully, because even small doses of THC can have strong effects in naive users. And again, there's no reason for that patient, the Parkinson's patient, the pain patient, the elderly pain patient, to have a negative experience. We really need to do better. And then finally, it's worth noting too that the risk-benefit profile can be dramatically different based on age. And we talked about this in some of the previous lectures, but as we draw down here to the end of the module, I think it's worth highlighting again that I think age is a very important predictor of the risk-benefit profile. And the risks are higher in younger people, risks are much lower in older people, or at least for many groups. All right, that's it.